Welcome to AETCM's Emergency Medicine channel. Today we will be discussing a very commonly seen emergency in any emergency room. So it is foreign body nose. So basically it is common among toddlers. When they are more curious to put in things into their nose, they are more commonly present to our emergency room. So basically the common things that they stuff into their nose are some beads or peanuts, popcorns, anything they get across while crawling or like while moving around, they stuff it into their nose. So this is a common emergency in any emergency room. So basically there are some techniques by which we can remove the foreign body from the nose. So important points that we have to remember is that if we are like visualizing the foreign body from outside, that is like if the foreign body is like at around the level of the inferior turbinate or below that, we can attempt these measures and we can like remove it. But if we are not like very clearly seeing it, don't try to blindly poke inside so that the foreign body may be pushed further inside and it may be causing some trauma. And another thing is like we will be pouring in some nasal decongestants while the patient is having some foreign body inside. If it is like some objects like beads and all, these decongestants help in reducing the edema and in removing the foreign body. But if it is some objects like peanuts or grams or some vegetative material, if we are introducing some fluids like any decongestants or any other fluids, it may lead to further swelling of these things and further they stuck in the nose. So if we are sure of like if it is some beads or something, we can put 1 or 2 drops of the nasal decongestants before removing that, so that the edema will reduce and the foreign body can be easily removed. But if it is something like a peanut or something, don't go for any decongestants or anything, because that can lead to further swelling of the object. And another thing is we commonly find small button batteries are being introduced by the child into the nose. In that scenario also, it is better not to pour in any sort of liquid. If it is like a decongestant or like any fluid flush or anything, don't try to introduce that, because it can lead to the release of some corrosive material, or it can lead to some electric discharge and all those things, which may lead to local necrosis, local trauma, irritation and all those things. So this is a common points that we have to remember before like removing the foreign body. So the commonly used technique, the easy technique in removing a foreign body is the mother's kiss technique. So in a mother's kiss technique, like we know that the child has a foreign body inside and we can't remove it. So we can make the mother perform that. So like the basic thing is we will be closing the nostril of the opposite nose. That is if the foreign body is on the right, we have to close the left nostril and we have to make the mother like blow through the mouth of the child. That is the mother should make a tight seal around the mouth of the child and give a blow through the mouth, so that that force will push out the foreign body outside. And we can go for like 2 to 3 attempts, because bit by bit only it may be coming out. If it is coming out and it has come to the external nares, we can milk it out. So it is the mother's kiss technique. So I'll just demonstrate how we perform the mother's kiss technique. So basically, if the child is we are doing it in a simulation based pattern. So we have a mannequin. If the child is having the foreign body on the right nostril, we can like one of the assistants, maybe like the doctor, can help in closing the left nostril, and we have to make the mother like give a blow through the mouth after confirming good seal. So we have to occlude the opposite nostril and we have to blow through the mouth after giving adequate seal. Okay, we have to close the opposite nostril. After giving adequate seal, we have to blow through the mouth. So that is the mother's kiss technique. So the child will be very cranky, may not be like cooperating to it and all those things. So if it is required, like small procedural sedations can be given, but it is better not to give it at this stage, because if it is not coming out, we may have to go for further interventions. So if it is a mother is doing that, the child will better cooperate. That is the idea behind that. Rather than another person going for this, if the mother is doing it, the child will be better cooperating. So other thing is, if the mother can't get a good seal, or the mother is very apprehensive and all, we can go for a back mask technique. Here also the principle is the same. We can close the opposite nostril and we can get a tight seal around the mouth with the mask, and we can give a small blow. Okay, we can bag it by giving a close seal around the mouth with the mask. So when we are giving a blow, the object will come out. Okay, this is another technique or another alternative which follows the same principle. So this is the commonly used techniques in the ED. If it is not coming out, then we can observe that foreign body, as I told, at the level of around the inferior turbinate or just beneath that. Then we can introduce a small Foley's catheter, a very small size, maybe less than 5 French size. Foley's can be introduced, and once it passes behind the foreign body, we can inflate it and then pull it back so that the foreign body will dislodge outwards. Another technique that is used is mostly in our ENT OPDs and all, they'll introduce a Eustachian catheter. They'll introduce it, pass beneath the foreign body, hook it and pull it out. Another thing is a trademark known as a cat's extractor. So the cat's extractor, where there is a syringe attached to a very fine cannula, thread-like cannula, and they will introduce this syringe with the cannula inside the nose, and once it passes behind the foreign body, we will inflate the balloon at the tip of that cannula by instilling air, and then we can pull it back. When we pull it back, the foreign body will dislodge. So it can be very easily, beads and all those rounded objects can be very easily dislodged and removed in such practice. So if at all we are attempting these things and we can't remove the foreign body, then obviously we have to get the help of the ENT specialist, and we will have to go for the diagnostic nasal endoscopy. And in those practices, and also in small procedures the extractors and all, we can give mild sedations, maybe a nasal spray of midazolam or something can be given if the child is very much irritable. Otherwise, with the child fully awake itself, we can get the thing done. So as I told, if it is a foreign body, what we have to know is that if it is if the mother had seen it or someone had seen what the child has stuck inside, we'll be knowing what it is. But if we don't know what is inside, we have to be very cautious, because if it is something like a button battery and all, there will be corrosion, necrosis, all those issues will be happening. And sometimes acutely presenting, if the child has stuck something inside and coming to ER in very small time is very rare. Mostly the child will have stuck something inside many days back. Then the child will be having some inflammation, some symptoms like a running nose or some fever or something will be there, and then only we will be realizing that there is a foreign body in the nose, and there the removal will be slightly difficult, because already edema might have happened, and then we can give some small dose of decongestants and remove it. So this is a commonly seen emergency in any ER, that is the child coming with a foreign body in the nose. Okay, and if we are not removing the foreign body, or we are attempting to poke it more inside, we will have issues like local trauma, bleeding, then a worsening of edema. Sometimes the foreign body can be pushed back inside, leading to aspiration and all those things. So only if the foreign body is clearly visualized, we have to go for these techniques. Otherwise, we will have to go for further removal under better visualization, maybe under the supervision of an ENT specialist or someone, we will have to go for the removal. So I have demonstrated the common technique that we practice in the ED for removing foreign body, that is the mother's kiss technique, and the alternative we can go with the back mask. The same principle is being used, but we can go for a back mask in removing the foreign body. And this is the foreign body nose. So these are the common things that we see in our ear. So I hope like you have got a clear idea about the foreign body removal, especially how to remove a foreign body from the nose. And so I hope you all have got an idea. Thank you.